My name's Rachel and I'm Nurse Liz.
My name's Amy and I'm the receptionist.
My name's Rochelle and I am Ava.
My name's Cassandra and I am Robin.
Our group focused on the mental health illness depression. In this video, we demonstrate effective strategies as well as non-effective strategies which a mental health nurse may use when communicating with a patient who has depression. The questions and communication strategies used in the effective video would assist the mental health nurse in completing an accurate mental state examination and would assess the patient's risk level.
Next, you guys can go through. Who are you?
Hi, I'm Robin. I'm the support person.
Okay, they might not have a chair for you, but you can go through.
So, hi, are you Ava? Okay.
Yeah, that's me. And this is Robin.
Okay, great. Well, I'm your nurse today. Let's jump straight into things, shall we? Why did you come in today?
I guess I've been feeling really low lately.
Okay, so why do you think you've been feeling low? Is there anything happening in your life to make you like this?
Well, Ava's mum passed away from a car accident 12 months ago. It's coming up for a year's anniversary soon.
Okay, so what do you do for work?
I work at Coles.
But she hasn't really been going lately.
So if you're not working, then who supports you?
I guess my dad does, but he's struggling too. It's been hard on everyone, really, especially my sister.
Okay, but there's no point dwelling on it. I mean, it's been almost a year and you need to all continue on with your lives. So if you're not at work, then do you just sleep in all day or?
No.
She doesn't always, but sorry, I didn't get your name, but she does drink when she's at home, and that is what concerns me a bit.
Okay, well my name is Liz, thank you. So do you sit at home drinking and feeling sad? Is that how you would describe yourself?
Yeah, but no.
I'm gonna write down yes for that. So how much do you drink? Would you say this has ever gotten you into trouble?
Probably a glass a day.
Nope, try a bottle.
Okay, probably a bottle, but look, I've never really gotten into trouble. The only time was 2 weeks ago during a booze bus. So I got caught drink driving after I dropped my little sisters off at school.
Right, well we've all been there, hey, but that isn't good. So do you have any alcohol on you right now? Come on, you can be honest.
Actually, I do.
Okay, Ma.
So do you really think that's helping your situation? No? Okay, well moving on, have you ever had thoughts about topping yourself or self-harm?
Sorry, what do you mean?
Killing yourself?
Oh, no.
Okay. Well, how about hurting others? I mean, your younger sisters from your drink driving.
No, I would never do that. What a horrible thing to say.
Okay, I think you just need to calm down a bit there, Ava. I'm only repeating what you told me.
That's not what I said. I didn't say that.
Okay. Well, do you have a medical history of depression, or does your family have a history of depression or suicide?
No, and I'm not sure. I think my dad has been taking medication or something since my mum died.
Okay. Well, getting back to the paperwork, Ava, are you hearing or seeing things that myself or Robin may not be able to see or hear?
No, I'm sad, okay? I'm not fucking crazy.
Okay, well, calm down. Okay, so what I'm going to do is submit this paperwork to my receptionist and I'll get you in touch with a psychologist to assist you with your depression. Have a good day. It's nice to see you.
I told you we should move on.
The video just shown was the ineffective way of using a mental state examination to assess a patient with depression and alcohol misuse. We can use an MSE to gain a comprehensive assessment of the patient and their mental state. MSE can aid us and determine the level of risk to the patients themselves or others. So what went wrong in the video was that the receptionist was rude and unwelcoming. The nurse didn't introduce herself, and the body language was very disengaged and dismissive because she was leaning back. The nurse doesn't build any rapport with Ava or Robin and is unfriendly and unwelcoming throughout the session. There's no ethical confidentiality or legal responsibility outlined by the nurse. And the nurse also asks very closed-ended questions, so Ava cannot really get the story out. The nurse also disregards Robin and does not show any empathy to Ava or acknowledge the feeling that she had maybe regarding her situation. The nurse is focused only on filling in the paperwork and not actually assessing Ava. The nurse is rude and abrupt and hardly looks up from her paperwork. She always adds her own opinion about Ava's circumstance and is very judgmental, especially when Ava brings up her drinking. Nurse Liz adds information to her notes and the MSc that are actually incorrect. She says she decided to put in something that Ava didn't actually feel, and she was not clear, concise or professional when asking Ava if she'd ever thought about killing herself. She actually said topping herself, which was incorrect. She's defensive and did not exercise any de-escalation techniques when Ava was very clearly upset. The nurse gives Ava a medical diagnosis by saying that she has depression, and Nurse Liz asks Ava regarding hallucinations and then compares it to Robin, asking is it something that Robin may not be able to hear or see as well, which isn't right. Nurse refers to Ava to a psychologist without any of her consent and is very dismissive towards Ava and just all of her problems.
Ava Brown, they're ready for you now. Would you both like any tea or coffee or anything?
No thanks, I got some water.
Okay.
I would love a peppermint tea, please.
Yeah, well, I'll get that for you now. Just through this way.
Good afternoon, thank you for waiting. My name is Liz and I'm a mental health nurse here. Which one of you is Ava?
That would be me.
Well, hi Ava, it's a pleasure to meet you. And who is this with you?
So this is my friend Robin. She's just here to support me.
And just make sure that she tells you everything.
Okay, oh that's good. Well, it's lovely to meet the both of you. And thank you for coming in with Ava today, Robin. Well, firstly, before we begin, I just wanted to disclose that this is a very safe place and what is said between you and I will stay in this room unless you're at risk to yourself or others. Is that okay with you?
Yeah, that's fine.
Okay. Alright, well that's good. So let's get started. So what brings you here today?
Well, I guess I've just been feeling low lately.
Okay, well how long have you been feeling low?
Probably quite a while now. More recently, it's been worse, I guess.
Okay, so maybe for like a few months or a year or...
Probably about a year, but it's been getting worse over the past few weeks.
Okay. Well, would you have any idea what's brought this on? Just feeling really low?
I mean, about 12 months ago, my mum passed away. She was in a car accident, so I guess maybe that. If not, I'm not really sure what else it would be. I can't, I mean, the day of her death is coming up soon, so...
Okay, well, I'm really sorry to hear that. It must be a very hard time for you.
Not really.
Okay, well, were you and your mum close?
Yeah, very.
Yeah. Well, usually when someone goes through loss, especially when it's sudden, and with somebody who they're even close to, they might find it quite challenging. Do you know how you've coped with it so well?
I had good support, I guess, and I had to be strong for my family. I have younger siblings who need me, and well, my dad really didn't cope, so I didn't want them thinking I was weak, because I'm strong.
Yeah, well, of course, yeah. Well, what sort of support did you have?
So I had Robin, she's been really, really good for me. And I guess my family too, my grandparents really helped, especially after the immediate shock.
Yeah, okay. Well, it's really good. It's really important to have a good network of support. So how has your dad been coping recently with it coming up to the day of your mother's passing?
I mean, he's not really doing that well.
Yeah.
He's drinking a lot, he's skipping work. So because I'm the oldest, I've had to take on like all of the responsibility. So driving my sisters around, like making sure they do their schoolwork, just doing like all those sort of things.
Yeah, okay. Well, that must be very hard for you and very stressful. Have you tried to talk to your dad about this at all?
I mean, like I said before, like I need to be strong for my family. I don't mind that I help him out, you know.
Yeah, well, you seem like a really strong person, Ava, and I think your dad must really appreciate it. So, like you said, your mood has been low lately. Can you tell me a little bit more about how you feel when you're in your low mood?
I guess I just feel really like flat, unmotivated, like I feel really sad and I won't be able to get out of bed or really do anything. I won't shower, just nothing.
Okay, well, so how do you spend your downtime?
I don't really do anything, but I guess I usually cook dinner for everyone and I'll have like a glass of wine.
Yeah,
More like a bottle.
okay.
Well, apart from that, I'll probably stay in my room quite a bit. Once Dad has gone to bed, I'll take it easy, you know, watch some TV.
Usually with some more wine.
Okay, alright. So you drink wine often then?
Yeah, I guess so. Maybe like every day.
Okay, well, what sort of wine do you prefer?
So, rosé is my favourite, but if I'm feeling fancy, I'll go for some red, or I'll just find whatever's cheapest because, you know,
Yeah.
money.
Yeah, for sure. Well, so how much would you say you drink on an average day?
I would say maybe like a bottle every 2 days, depending on how I'm feeling. But lately, I guess I have been drinking a lot more. I feel the need to, you know, be strong for my family. I can't let my emotions get the better of me. So the wine really relaxes me and helps me to forget everything and not be so like emotional, you know?
Yeah, okay. Well, are you okay with the amount of alcohol that you drink?
I mean, obviously not. Like, I probably shouldn't be drinking that much, but then at the same time, it's not like I'm drinking like a bottle or 3 bottles a day or anything, you know?
Yeah.
I've tried to suggest for her to do Pilates with me because that really helps me to relax as well.
Yeah, okay. Well, it's some other coping strategies might be something you want to look into. Do you have any hobbies?
I mean, I used to play volleyball, netball,
Yeah.
that sort of stuff, but since my mum's died, I've sort of stopped and they don't interest me anymore, you know?
Yeah, of course. Yeah. So, do you work at all, Ava?
I've worked at Coles
Yeah.
since I finished school and they've been really like helpful
Yeah.
with everything that's gone on.
Do you even still work there? You haven't gone in like 2 months.
Okay. Well, is there a reason you're not going to work, Ava?
Well, I guess I'm just busy, you know, like there's a lot going on and I haven't had motivation, you know.
Yeah.
Some days I can't get myself to go to work, I can't even get out of bed, I can't shower, I can't do anything.
Yeah, that must be really hard and frustrating. So, well, has alcohol ever gotten you into trouble?
Yeah, so recently I got done at a booze bus on my way home from dropping my sisters off from school, like to school.
Yeah. Yeah, okay. So, this time you'd been drinking in the morning?
I mean, technically I just hadn't stopped from the night before, you know, it was a Sunday night, it just needed a few to...
Okay. Well, so how long ago was this?
It was about 2 weeks ago,
Yeah.
and that's probably the main reason why Robin dragged me here.
It's just really out of character for her, and I'm beginning to be a bit worried for her now.
Okay. Well, do you have any history of mental health in your family, Ava?
I mean, my dad used to go to AA back when I was younger. I'm not sure if that's classified as mental health or not. And I know that he's been taking some sort of depression medication since Mum died.
Yeah, okay. And have you had any thoughts about killing yourself?
No, I'd never do that to my family.
Yeah.
They've been through like way too much.
Yeah, well, that's okay. I'm really pleased to hear that. Would you say that you could be like quite a violent person, or have you considered harming yourself or anyone else?
No, not at all. I mean, I get angry over my mum's death because, you know, like it was so sudden and it's not fair. But I would never do anything to hurt anyone else.
Yeah, understandable. Okay, would you say that you're seeing or hearing things that I might not be able to see or hear?
Oh no, like I'm not crazy or anything.
No. Oh, that's all right. Well, thank you so much for coming in today, Ava, and thank you for supporting Ava so well, Robin. I'd really like to refer you to a colleague of mine who is a psychologist. Well, from what you've told me, I think you're at risk to yourself and possibly others. And because of this, I just think it would be beneficial for you to start therapy if you're okay with this.
What would I need to do?
Well, if I referred you to my colleague, they would just talk to you about everything you've spoken to me about, and then anything else you really want to talk about. They could help you come up with some strategies to make you feel better, or they might consider your pharmacological options. I could make an appointment for you this week if that sounds like something you're interested in.
I mean, how much would it cost? I mean, you know, we don't have much, and you know, Dad's not really working and I'm not really working. Like, I can't deal with that extra stress.
Yeah. Well, there's many financial options, and I'm sure we could figure out one that suits with you best.
I mean, well, I suppose that sounds like something that maybe would help me.
Okay, great. Well, I'll get in touch with my colleague and we'll arrange for your appointment. Just for any other facts or questions about your mental health, here is our fact sheet that we have that might be able to help you answer any questions that you might have coming out of this. And again, thank you for coming in today, and it was lovely to meet you both.
Thank you.
Okay. The video just played was an effective way of using an MSc to assess a patient with depression and alcohol misuse. So in the video, we've got down what went well and what was improved since the last video. So in the effective video, the receptionist is warm and welcoming. The nurse introduces herself and her role. The nurse acknowledges Robin as a support for Ava, and uses a professional and calm voice as a technique for de-escalation if needed. The nurse's body language appears interested and inviting because she's leaning forward and having eye contact with Ava. The nurse builds rapport throughout the session and is not judgmental when Ava discloses how much or how often she drinks. The nurse outlines the ethical, confidential and legal responsibility, and that is accepted by Ava. The nurse only asks open-ended questions as invitation for Ava to talk and share her story. The nurse is empathetic to Ava's situation and her feelings and always is respectful and professional. The nurse also asks respectfully and professionally if Ava feels about killing herself and uses the correct terminology. And she asks Ava regarding hallucinations very respectfully as well. The nurse refers Ava to a trusted colleague with Ava's consent and explains why and what they would be able to do to offer her. The nurse reassures Ava regarding financial issues and getting help, and provides take-home documents for her to look over later.
Depression is a mental health illness which requires a diagnosis from a doctor or mental health professional. Depression can affect the mental and physical state of a person. Some common signs and symptoms include insomnia, change in mood, a gain or loss in weight, a presence of anxiety, energy loss, and suicidal ideation. Depression can occur at any time in a person's life. However, it may be triggered by factors such as stress, crisis, trauma, or genetics. Studies show that 1 in 10 people are experiencing depression or depressive emotions. However, it is more prevalent amongst women. Women are most likely to have an onset of depression between the ages of 30 to 49 years, and men being 15 to 29 years. Early detection of depression is known to give patients a better outcome. Visiting a GP is a common way of initiating treatment for depression, as they can refer you to further treatment.